If you've been dealing with erectile dysfunction and you've found yourself Googling for the answers at some point, you've probably come across a lot of conflicting information. Stress, low testosterone, age, it's all in your head. Well, in fact, it's not in your head at all. In this episode, I want to give you a clear, honest answer to what is actually happening, based on what the evidence shows and what I see clinically every week. Because once you understand what's driving the problem, everything else, including your options, starts to make a lot more sense. My name's Steve. I'm the founder of Male Health Clinic based in Beeston, Nottingham. I've spent 15 years working in musculoskeletal rehabilitation, and for the past several years I've specialised specifically in men's intimate health. I see men with erectile dysfunction every week, men of all ages, all backgrounds, and at all different stages of the problem. And the single most common thing I notice is that most of them don't actually know what's causing it. So let's break it down properly. The most common cause of erectile dysfunction by a significant margin is vascular. What that means in plain English is blood flow. An erection depends on blood flow into the penis and staying there. For that to happen, the blood vessels in that area need to be healthy, flexible, and unobstructed. In many men with ED, what's happening is that those small blood vessels have developed into microplaques, tiny deposits that restrict the blood flow over time. This is very similar to the process that affects cardiovascular health more broadly, which is exactly why erectile dysfunction is sometimes an early indicator of heart health worth paying attention to. This is not the same as saying your health is in trouble, your heart is in trouble. But it does mean that the plumbing in that area isn't working effectively as it should, and that's something that can be addressed. It's worth noting this process can happen in men in their 20s and 30s. It's not exclusively an older man's problem. Beyond vascular health, there are two other physical causes worth understanding. The second is hormonal. Testosterone plays a role in sexual drive and function, and it doesn't decline with age. But this is important. Testosterone alone is rarely the complete picture. Many men with ED have testosterone levels within normal range. Low testosterone can contribute, but it's usually one piece of the larger puzzle, not the whole answer. The third is pelvic floor dysfunction. Most men don't know they have a pelvic floor, and few still know that it plays a direct role in erectile function. When the pelvic floor muscles are too tight, too weak, or poorly coordinated, it affects both the ability to achieve and maintain an erection, and in some cases causes pain or discomfort. In my clinical experience, most men with ED have a combination of these factors, rather than a single isolated cause, which is one of the main reasons a proper assessment matters more than a single test. Now, I've been talking about physical causes, and I want to briefly address the psychological side. It's absolutely true that anxiety, stress, and depression and performance anxiety can cause or worsen ED. Anyone who tells you it's never psychological is oversimplifying it. But here's what I also see regular. A man starts with physical causes, develops understandably anxiety about it, and the anxiety then makes the physical problem worse. The two become intertwined. When somebody tells you it's all in your head, as if it ends that conversation, it doesn't. Because even a primary psychological presentation often has physical contributing factors, and vice versa. The only way to know what's actually going on in your specific case is a proper assessment that looks at it all. So what does that practically mean? It means that erectile dysfunction in most cases has an identifiable cause, and where there's an identifiable cause, there are options. Medication like Viagra works temporarily increasing the blood flow. For men, that's a useful short-term tool, but it doesn't address the underlying vascular issue, the pelvic floor or the hormonal picture. It manages the symptom or symptoms. What I encourage any man watching this to understand is there is always a non-invasive, drug-free approach that works on the root cause. and that's an option that is available to many men who simply haven't been told it exists. In the next episode, I'll go on to what those options actually look like in more detail. If you found this video useful, please subscribe below, because I'm going to keep putting out clear, honest content about men's health on this channel. No jargon, no scare tactics, just information I think most men should have access to. And if any of what I've covered today resonates with your own situation, we offer a free, confidential, informal chat here at Male Health Clinic. No obligation, no pressure. Just a straightforward conversation about what's going on and what your options might be. The link is in the description below, and I'll provide more information in the next episode.